Okay, so we'll just give it another moment or so until people start trickling in before we get started. This is a very exciting topic this evening. I've been looking forward to this pep talk for quite some time, so we'll just give it another maybe 30 seconds or so before we get started. My goodness, we have quite a few people this evening. Okay, so we'll get started. So thank you everyone for joining us this evening. This is the National Blood Clot Alliance pep talk, Patients Educating Patients. And tonight's title is Blood Clots and Compression, the do's, the don'ts, and what you should know. And we are absolutely thrilled to have with us this evening Dr. Suman Wasan, who is a clinical professor of medicine at the University of North Carolina Health and Vascular Medicine, and she is at the Rex Vascular Specialist in Raleigh, North Carolina. Dr. Wasan, thank you very much for joining us this evening. We're so delighted to have you and greatly appreciate this. And of course, as always, I'm joined by my PEP partner, Todd Robertson. And shout out to Todd and his background because it's absolutely beautiful. So thank you for doing that. Okay, so again, welcome. And before we get started, we're going to have some short poll questions for the audience. And Todd, I'm going to ask you to kick that off, please.
Absolutely, folks. So we always do a little poll before and after each Pep Talk episode. We would love you to quickly just answer these questions, and we'll get through this real quick. Question number one, what is the top reason you are interested in learning more about compression? I've heard it could help prevent blood clots or recurrence. I want to learn ways to reduce my discomfort and swelling. I've received conflicting advice and want more clarity and guidance or other. And question number two, do you currently use some form of compression? Yes or no? If you could please do that. I want to remind everybody that we are not doctors talking to you, telling you what to do. We are providing some guidance. We want you to talk to your medical professional about your specific situation when it comes to compression and all other medical needs and questions. So please make sure that you do that. And did everybody get it answered yet? I don't see any results yet, but we're going to read those off. And here they are. So what is the top reason you are interested in learning more about compression? 35% say I've heard it could help prevent blood clots or reoccurrences. 22% I want to learn ways to reduce my discomfort. And 32% I've received conflicting advice and I want more clarity and knowledge. So everything's kind of right in the middle of there. I think everybody's kind of wanting to know similar answers to all their questions that have been asked for so long. And there are a lot of questions that that we can't answer, but we're going to try to get to as many as possible. And there are things that people want to talk about. 12% say that there are other. So it's a big conversation, and we are certainly so glad that you are here, Dr. Wasan, and look forward to your presentation. I think we're all going to learn a lot.
Thank you.
Okay, so with that, thank you for that. And I just want to acknowledge that we have people literally from around the world this evening that have tuned in for this event. And yes, it will be recorded, but people from New Mexico, people from the UK, people from Canada. We have some folks that are coming in, I think, from Australia, Miami, Los Angeles. So this is really quite exciting. So thank you everyone for tuning in. Okay, so Dr. Wasan, I know you have a presentation that you're going to show us, but before we get started, so you're an expert in all things compression, and yet all of us on this webinar, we're really struggling to get the answers about compression from our healthcare providers. So can you explain to us, like, what exactly is compression? What does it incorporate for people? And once you answer that, then I'm going to ask you to launch your presentation.
Yeah, big question. So thank you all for having me this evening. I was delighted to be asked. So, compression in the very raw sense is an application of some sort of external pressure and in this case against the leg. We'll talk about lower extremity and exclusively. We do use compression in other places, but we'll talk about the leg. And it can have a variety of things it does. Many of you watch sports. You've seen of late many of your marathoners, your baseball players, your basketball players are wearing compression, even on their arms. And so when it's very, raw sense, it is just application of a pressure against the skin. And tonight, what we're going to do is specifically talk about that after, for patients who have suffered a leg blood clot or a DVT. So that's what compression is. And what I'd like to do is just start off with a sort of the basics, maybe what you could call compression 101. And, so everybody's sort of on the same page, and then we can take some questions. So thank you all for joining us. All right, so I'm already stuck here. It's not moving forward. Let me stop sharing and then share again. This happened to me once before. So I'm an expert. And let's do this and see if we can go now. There we go. All right. So the first thing that we want to define is the goals of compression. And I think this is where we have the most confusion. Is the goal of compression to prevent post-thrombotic syndrome? And we'll talk about that, what that is in a minute. Or is it to treat the signs and symptoms of post-thrombotic syndrome? So what post-thrombotic syndrome is, post-clot, are the signs and symptoms, and there's some scales that are used to, accurately define this, of what happens after you have a blood clot. What do you feel? What do you see? And some people feel nothing or see nothing, but typically it's described as pain, swelling, itching, heaviness, cramps, tingling, the development of varicose veins, redness, or skin darkening and changes. And so here you see two examples, one in the top panel where it's pretty subtle, and one on the bottom panel which has some more skin changes. So compression may help some or all of these symptoms, but some people don't have any of these signs or symptoms after a blood clot. So I show some gross pictures to get your attention, but when we think of it, this is the worst of the worst. You see ulcers and skin changes and darkening, and it looks just terrible. But this actually represents the minority, the small minority of patients with blood clots. What is more representative are these patients. They might have slight increase in size of one leg. They might have a few little, what we call spider veins. They may have some dilated veins at the ankle. This is actually most patients. They may not have any skin findings at all or swelling, but they may feel some pain or cramping or those other symptoms I listed, tingling, especially by the end of the day. So you can see it's a large spectrum, and compression may not be for everybody. And so that's what we're going to sort of talk about, some of the nuances. So what is it? And this is a little bit of a complicated slide, but let me show you what this is. And so this is a depiction of what the veins do in the leg. And you have the surface veins and you have the deep veins. And when someone gets a deep vein clot, two things can result. These don't always happen after a blood clot. We have some statistics about how often they do. Two things can happen after the clot is treated. One, the veins can be scarred down and narrowed, or two, the valves that keep the blood moving up can become damaged and leaky. That is sort of what causes post-thrombotic syndrome. So at the end of the day, things back up. The blood stays in, but the fluid may get out into the skin, and that is very inflammatory. The body doesn't like that fluid in the skin. It causes an eczema. People think, so I have a cellulitis, but actually it's inflammation. And over time, the body doesn't like inflammation, and it puts down a scar. So swelling, inflammation, scar, or some people may not have overt swelling, but feel it in their leg. And that's what it is. I tell my patients, just imagine you're going down the highway, you have a 4-lane highway, and all of a sudden 2 lanes is closed. Well, at 5 o'clock, by the end of the day, things are backed up. And that is your leg at the end of the day in someone who may have valvular damage or narrowing after a blood clot. You see here on the right panel, we've now applied that external pressure or a compression sock. What does that do? That keeps things moving up. It limits the swelling, it limits the inflammation, and that is the goal. We know from biology studies and pathology studies that the skin is actually preserved better. So we have both signs and symptoms that can be improved, but we also have skin tissue samples that we know that this could help. But again, not everybody suffers this whole spectrum of inflammation. So this is where most of the confusion arises with the physicians that you talk to who treat blood clots, which may be mostly hematology, vascular surgery, and people in my group, vascular medicine. So all the studies that are out there that are published in the medical literature, even to date, look at preventing post-thrombotic syndrome, preventing the development of the swelling and the darkening and the pain and the tingling and all of that. And the one that is quoted the most is the SOX study. Nice name. I was actually an investigator for this study 15 plus years ago. And this is why you go to the doctor and they say compression doesn't work. This was a randomized study of 800 patients. I tell you, we had to measure patients, and then they got their SOX in the mail. We weren't allowed to know which ones they got, although I can tell you it was pretty obvious when they came in. And the goal of it was to see how many of them at a year developed the signs and symptoms of it. So when that study was published, they used tight socks, which we rarely use anymore, 30 to 40 millimeter, and we'll talk about compression in a minute. And they found that there was really not much difference in the prevention of post-thrombotic syndrome, okay? Now, people didn't like that because we know patients who have pain and swelling benefit from compression. And so there have been other studies that have shown different ones. And you can see, I don't want to go through too many studies, but you can see there's actually 2 ongoing European studies that are still looking at whether it helps and using lower compression. But this is all to prevent post-thrombotic syndrome. If you already have the signs and symptoms, these are not applicable to you. So if you go into your doctor and they say, oh, that doesn't work, we have studies that doesn't work, this is what they're referring to. They're not referring to, you have it, is compression going to help you? And that's where the confusion arises most of the time.
Before you move forward, could you actually go back to the previous page?
This one or the one before?
The one before. So we had somebody who just asked the question, what does the orange represent in this image?
That's an excellent question, and I should have said that. So if you think about, and this will go on to some of the questions we have about travel, we know that the heart pumps the blood in our arteries to our feet. That's what we know is circulation. Well, how does that vein blood get back to the heart? We don't have a pump in our foot. So what the orange represents are the calf muscles. And when you walk, the muscles squish the veins and push the blood up. And that's why prolonged standing and sitting, which we'll talk about in a minute, can worsen swelling. So what the orange is are the calf muscles that surround the veins and are pumped to get that blood out of the veins and back to the heart.
Thank you.
So going back to treatment versus prevention, this is a recent guideline in our medical literature, and Susan Kahn is the international expert who actually did the SOX study. She's in Canada. And you can see that for prevention of post-thrombotic syndrome, they say elastic compression can be considered. And this was kind of a weak recommendation. We grade our recommendations in the medical literature. But you can see here under treatment of established post-thrombotic, it says elastic compression should be used, a strong recommendation. So you have to distinguish prevention versus treatment. The problem is there's no studies on treatment. There are only studies on prevention. And that's what creates the confusion among providers when you talk to them. So this is a document. It's a medical document. But again, what you're going to hear tonight is all my opinion. So, you know, take what you can and leave the rest. But the STRIDE document is put out by a group, and it's in this journal, and it is probably the most comprehensive discussion about compression that I've ever read. It's something like a 42-page document. A lot of my slides are from here. STRIDE stands for shape, texture, refill, issues, dosage, etiology, how you should, you know, if you really want to decide which compression to use. This is a document, a medical document, but I think is probably the best guide I've ever seen. So if you look at compression, just to let you know, think of your sweater. And this is really how they're made. You have the yarn, and you can have a loose knit or a tight knit sweater. And then you have the inlay. And so the body yarn is sort of the stiffness, and the inlay yarn is the compression. So the tighter or the looser, it's like a sweater. And this is the thread. You have your compression, which is the blue, your body yarn, and then it's usually, it can be coated in cotton for some people that are allergic to latex or other, you know, sheer or other different things. But this is where compression comes from. And there's also two different kinds of compression. There's what's called circular knit garments and flat knit. Circular knit is like your sweater. This is the machine. I was actually able to tour a compression factory from thread to where they sewed on the tag at the end. It was really interesting. And this is a circular knit. These are, they add and subtract needles to make it thicker or thinner or more firm or not. And there's no seam. These are the ones you buy at the store on Amazon, etc. Flat knit is a little different. This is made stiffer and tighter. These are typically custom garments. They're usually thicker, but sometimes on the box, they don't indicate whether it's a circular or flat knit. There's no way to know. But if you were measured for custom, often you would be measured for a flat knit garment.
So if you get a prescription from your doctor, is that for a flat knit?
So most physicians don't know that they're circular and flat knit, and prescriptions now are not needed. Where we write prescriptions are for people, the few people that have insurance coverage. In my experience, this has been military, some of the TRICARE, the Veterans Administration does cover them. Some insurance plans do it. So no, it's not indicated. Typically, these are fit in a physical therapy clinic where they may be going for other reasons, or a specific, usually a physical therapy clinic. So where did all these measurements come from? So there are actually standard zones depending on whether you do knee high, thigh high, or full. But the reference is actually here at the bottom of this, what's called the gastrocnemius medal. That is your standard. So if you were to compare one compression versus another compression sock, they would measure, put a transducer right here and see whether your sock provided that degree of compression. They would measure it right here at the bottom of this muscle. So that's the sort of the standard for companies that do this.
So we have
yes.
So just another question. We've had some people ask then, why do they need to have full length versus medium versus shorter length compression socks?
And it's a good question. And actually, we'll talk about it in a minute, but in some ways it's patient preference. It's where they experience most of the symptoms. So obviously gravity has its biggest effect below the knee. So in many people, from the calf to the ankle is where they need it the most. However, some people, especially with blood clots that are higher in the leg, have more thigh swelling, and they may benefit from wearing a thigh length or even a full length garment, depending on where they feel the most comfort. But a lot of this is not dogma, it's patient preference. You have women that wear dresses, they want to wear a full length. And we'll talk about the whole summertime thing. I have a suggestion for that coming up. So it's really based on what you benefit from individually and what you prefer.
And you might be touching upon this later, but we've also had questions. How many pairs should people have? How often should they be switched out?
Well, yeah. So, I would assume people change their socks every day, so or wash them every day. But in general, the more you pay, the better garment that you get, and they last longer, but that's not always true. So I saw a lady the other day with some from Amazon that were $10 that I thought were great. They tend to wear out. If you wore one pair every single day, they tend to lose their wear by about 3 months. So if you do the math, if you have 7 pair or 4 pair, you know, typically if you have one, you can get away with, you know, with one for each day of the week for a year in general for ones that are good quality.
Okay.
But here's the other confusing part is most of the major compression companies, now there's a lot of what my daughter calls dupes on Amazon, are from European countries. The big four, Sigvaris, Medi, Juzo, and Jobs are all European. And really family companies that expanded across the country. I've actually met some of the people who founded these. And they all have different scales in terms of the millimeters of compression that they provide. And you can see us here on the bottom, the US, and not a single country where these were made and discovered matches our measurements. And so that's the other confusing thing is what you may see on a box or advertised may not line up with what we do here in the US. But typically light compression, class 1 is 15 to 20. Class 2 is 20 to 30. These are available over the counter in the drugstore on Amazon. 30 to 40 tends to be more for people with lymphedema. So we're not using these that much anymore after blood clots. And there's even some that are rubber that are higher compression than that.
Mm.
So keep that in mind also. And why is the sizing so, you know, the compression so messed up on the box, depending on where you get it from. You can buy European products on Amazon.
Can you touch base on when you had the stride guide up, you had a reference to 15 to 20 was for light compression, like what they all reference. I know some was for no history of DVT and some was for moderate venous disease.
Yeah, I had that up there. That is just a guide that the stride document puts out. And on the next slide, I'll tell you, I tend to be pretty practical about what compression you should use. And bottom line is the compression you should use is the compression you will wear. And if that's 10, there's also 8 to 10 that you can get, then that's what you should do. And I have a number of men I see in their 90s, and they can't do this every day, for arthritis or other reasons. And so, you know, they may not use a sock. They may use some of these other things that I'm going to talk about. So the bottom line is you should use the compression that you feel it helps, that you will wear. And these are guidelines, but at the end of the day, you have to wear them. And so, you know, this is just what's been shown to be helpful and been studied, but it's not dogma in terms of the individual patient. Okay. So here are some examples of compression. So I will say in someone who has overt swelling, meaning you can see the swelling, one beg's bigger than the other, it goes down at night, it's, you know, worse at night, better in the morning. I will tell you that compression socks are not treatment. Compression socks are maintenance in someone who has swelling. You want to get the swelling out with a wrap, and then you want to don a sock during the day to keep it out. And so people who say, I wear a sock and I get this big cut at the top and they dig in, well, then they shouldn't be in a sock. They need to get the swelling out with this wrap. This is a patient of mine, and like 2 days ago, and I said, can I take a picture of this? I'm doing this podcast. And he said, sure. And his leg, he had a blood clot several years. This leg was bigger than this. He, you know, how doctors love to make that little indentation, that pitting. He had pitting. That means that swelling is reversible. I wrapped his leg. I showed him how to do it. This is a plain old ace bandage that you can get at any drugstore on Amazon. And I told him it's going to loosen up by the time you hit the car. Rewrap, 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 get the swelling out to up here. And then after a few days, when your leg is maximally reduced, which it will be, then go to the store and get your compression sock to wear during the day. This middle panel is another example of that. This is called a triple layer wrap. The difference is it has an inner gauze layer. So people may have drainage or they may be sensitive. It has the middle compression layer like this, and then it's held in place basically with the sticky tape that we call Cobain. This is sometimes better for people who are on the verge of a wound or people that may be in an assisted living that can't wrap every day. We can do this twice a week, that kind of thing. And then, yes, I'm a little compression nerd. So while I was getting my COVID booster, I go and take pictures of what they look like. And this is from CVS. I have no financial relationship, but you can see CVS has a number of compression garments next to the sports, and they have that 15 to 20, 20 to 30 right there on the box. So, you know, they actually have this brand, and they have the Sigvaris brand, which is up here. I guess I didn't get that in the picture, but you can get these now anywhere. And in general, but not in stone, the more you pay, the better quality the garment is. Now, here's where I do show and tell. So here is some compression socks on a little ring. How do you know if it's a good sock or not? So again, not dogma, but if you put your hands in the sock and you stretch, if you can see that white elastic easily, or whatever color it is, then it's probably not going to hold the compression. But if it's pretty hard for you to stretch it and you don't see it, it's probably pretty well made. And that's just a little trick that you can use to see if you've got a cheap sock or one that will last a little bit while and provide reliable compression. I don't know if that's helpful or not, but okay. Any questions about that? So remember, we use a wrap to mobilize swelling, and then we use a sock to keep it out. Now, if you don't have any swelling and you're using it for pain or fullness or tingling, you may not need to do the wrapping piece.
So what about the ones where you, like the ones you wear in the hospital, the ones that constrict?
Excellent. So those are affectionately known as TED hose, completely different birds. So TED hose were validated in the 1970s in surgical patients. So back then we didn't have all these medicines that we have to prevent blood clots. So patients who underwent regular surgeries, gallbladders, etc., received TED hose, what's called 8 to 18. So they're 18 compression at the ankle, they're 8 up the thigh. And they were found to reduce the risk of blood clots in post-surgical patients. That's it. They have been tested in medical patients and in those in the hospital, and actually been found to be not that effective except in stroke patients. And so now where you're more likely to get an injection or something to prevent blood clots, which has been shown to be more reliable and effective than the TED hose. But somebody that may have a hip replacement or a knee replacement because it's a surgery may be asked to wear that TED hose to prevent a blood clot. So they're to prevent a blood clot after surgery. They do not have the same graduated compression as what we're talking about today.
Does
that help?
Yes, it does. Thank you.
Thanks. All right, so here's some other examples of, you know, nice argyle and sheer and thigh and dot. And to make that point, Leslie, that you asked about, you should wear what helps you and that you'll wear. And you know, I always tell, for example, my patients to start low and move up. You don't want to start too tight and not like them and be turned off. Start low, maybe start with a wrap, get used to that, and then move up to some compression, and then just move up as tolerated. I personally have tried all of this myself, and I wear a 15 to 20 to work. 20 to 30 for me feels too tight. I think I've ripped a couple of pair. 30 to 40, forget it. Now I haven't had a blood clot, but I have had veins treated, etc. So, you know, I wear them. I've drank the Kool-Aid. I show my patients what I have on, and I say, look, you can get something like this, or, you know, but don't let anyone kind of bully you into a certain compression. Wear what works for you.
So
here's some other examples.
Because, most people, you know, this is good to know because a lot of patients are told they either have to have the thigh high, and you know, they don't want them, and there's no discussion about different lengths basically that they can be using.
Well, there are some studies, because I do a whole medical lecture on this too. There's very small studies that have looked at thigh length versus knee length in selected populations. For example, people who are paralyzed from a stroke, thigh length tends to work better in reducing swelling. So that's one instance. There are selective people who have lymphedema up until their thigh that benefit more from thigh length than knee length. So in certain cases, thigh length may be better, but in general, for the population we see that has most of their signs and symptoms below the knee because of gravity, knee lengths tend to be fine. Okay. Here's some other examples. You see, you get all sorts of things. There's this little Velcro boot. There's this Velcro thing that's usually worn at night. And these two I particularly like. I don't have any financial relationship to these companies, but this Ferro Wrap I tend to use a lot in older patients because they can just Velcro it on and they can change the compression themselves and they don't have to pull it on. This is also the Cirque Juxtalite is another one. It has less Velcro. And we use these a lot in our clinic. You can now buy them without a prescription. When I started in this field 25 years ago, these were $700, $800 prescription only, but now you can get them between $60 and $100 online. And they are also a nice option for odd shaped legs and for people to wear overnight if they want to reduce swelling overnight.
Is there any advantage to the open toe versus the closed toe?
Yeah, very good question. So that is also patient preference. Some people feel like using certain donning aids, and I'm not going to go into that whole discussion, but just know if you stop in the forefoot, you can push swelling into the toes. Okay. But I have sheer open toe that I wear with a slide in the summer. So it's a fashion choice for me. So it's really, again, some people don't like the squishing of the toes. If they have a large foot, they can feel like some brands are too short. That's a good option for an open toe. They can just put a little socket or something over it.
Right, thank you.
Here's some other examples. Now we're getting a little nuanced. So this one here is something I've just personally found. I actually bought this. I have it in a box next to me, and it was meant for sort of ankle support is what they say. But you see, it has these pads. It has a silicone pad here on the ankle on the outside and another one on the inside. And as many of you know, that's where you tend to collect swelling. There's a reason for that. And the bone there prevents you from getting good compression. So many makes this, and they now also make a sock that has this built in, that people tend to get swelling, inflammation, and they get scar around their ankle and they start to lose the mobility of the ankle. And this is something you can wear on its own at night over your compression sock. Like I said, people who have skin changes in particular, I bought one and I wore it around the house just to see if I thought it would do what I wanted it to. And I think it's not bad. Here's another example of, this is a sports sleeve. This is something you could find at Dick's or Academy. And people, all your marathoners are wearing this and then we can talk about that sports in a minute, but it ends here. So people say, can I wear a sleeve? Well, yeah, that's fine with a tennis shoe. But if you have swelling, it's going to push it into your foot. So I would say wear a tennis shoe with this. But if you have no swelling and you're doing this for pain, tingling, etc., you may want a sleeve. And then this is one that, again, Ames Walker is a company here in North Carolina. They make a crew compression sock. So remember, it's not perfect, but it's 100 degrees and you want to wear gym shorts. I have a lot of guys that golf. They don't want to be a dork. So they'll do the sleeve or they'll do this. And I say, look, you can wear this with gym shorts. Yeah, it may not get you as much as your taller ones, but it gives you compression in the area that is most effective, which is at the lower calf and ankle. So these are some options that you can order online. You don't need a prescription. You don't need a measurement. They have little scales that you can measure yourself and get the right size. And like I said, I have these, and this one, you've seen the sleeves on your sports people.
And what about, we've had a few questions come in about wearing compression at night. Should people be wearing them at night? Should they not be wearing them at night?
So going back to my discussion about circular knit, the way that they're made to resist swelling with activity. In general, you want to use compression during the day. And if you need something at night, you can do something like this or do a wrap. There's nothing wrong with it. There's nothing bad that's going to happen. But in general, they're made to resist that pressure when you're up. And then when you go to bed, they don't have as much what we call resting pressure. So it may be better to do something like a wrap where you're not walking or moving around as much. But again, there's nothing wrong if you feel like you also get benefit wearing them at night.
Okay. And for somebody who's had a DVT in one leg, should they only be wearing a compression sock on that leg, or do they wear them on both?
Again, if they feel like it helps their leg feel good, then they can wear it on both. Because like I said, I'm a big believer in it. I have daughters that worked retail. They used to make fun of me wearing compression, not anymore. And so they would wear them to work on their 7-hour cashier job and like think it was great. So people who work on their feet, people who stand all day, they may benefit from compression. But again, patient preference.
Okay, thank you.
All right, so this is a little bit of a summary of this whole issue of how you increase compression. You can do it through changing the type of garment, and we've now talked about circular knit, flat knit, Velcro wraps, etc. Or you can increase the compression by this measurement, this 15 to 20, 20 to 30, 30 to 40. And so there's different, you can see this is quite a grid. There's different options depending on what compression you want, day or night. And this is well, again, covered in this STRIDE document. The other thing that, we're almost at the end here. The other thing is that there's this issue of, you hear the word lymphedema. So there's another group of blood vessels in the legs called lymph vessels, like lymph nodes, and they don't carry blood. What I say is they're the garbage collector of the body. They are little stringy vessels that run up and down the legs and arms, and they clean up all the metabolites we produce and the fluid, and they bring it to the lymph nodes where it's processed and recycled. And in people who have either too much swelling because of the pressure we talked about, or the lymphatics are just not working, they get lymphedema. And so it's not unusual to have post-thrombotic and also have lymphedema, and we call that phlebolymphodema, basically post-thrombotic syndrome with lymphedema. And it gets confusing about, well, do I use compression? Do I use, and we're going to talk about pumps. But these are sort of going hand in hand in the patient who swells. Those patients may be sent for something called lymphedema physical therapy. These are specially trained physical therapists that may do a number of things. They may do this light massage to decongest the lymphatics. They may show you some exercises. They may do some of this bandaging to reduce swelling like I showed you, and talk about skin care, etc. The other thing that comes up, and I saw a few questions about this, is the whole pump thing. So let's talk about pumps. So does everybody recognize this fellow on the right? So that's LeBron. So LeBron does commercials for pumps. So let's talk about LeBron's pump versus these other pumps. So the pumps that are used in lymphedema swelling, so if you have post-thrombotic and you have the swelling, the phlebolymphodema, then there are pumps that sequentially compress. So ankle, mid-calf, high calf, thigh. And the goal is to move some of that swelling up. And these are some examples of medical pumps that have been approved by the FDA, that have been tested in these patients and approved. There's also one called FlexiTouch we're going to talk about in a minute. But then there's something called the sports recovery pumps. This is what LeBron is using. And you can see this is a press and hold. Now, I had a big fight with one of my patients because he is a competitive cyclist and he wanted to use this. And I'm like, yeah, use it, but show me the data that it does anything. Well, it feels so good. And I use it and I'm like, I'm sure it does. Well, I went and looked and he went and looked. And it turns out these are not FDA class, whatever. They're class, I think it's class C, which is actually can cause harm. So these recovery pumps are used in sports gyms by sports players. There's not really any studies that show that they reduce what we're talking about, swelling and lymphedema. They're not approved by the FDA. These are the ones that, you know, are on Amazon for anywhere from $200 to $2,000. And, you know, I caution you because they can cause damage. If you overcompress, the ones that are put out by medical companies that are FDA approved, they provide measured compression that's tested on you, that you tolerate. These other ones aren't designed the same, and they may provide either not enough or too much compression, and that could actually damage your lymphatics. So a pump is not a pump is not a pump. And then nuance to that, there are couple different ones. One is the traditional press and hold, which and then there's this other one called FlexiTouch that's more of a pulsing. And these again have been tested and approved by the FDA, at least in terms of not causing harm. So that's a little 2 minutes or 3 minutes on the different kinds of pumps. Again, I prescribe these in conjunction with lymphedema therapy so that a patient can try a pump and make sure they like it and it helps them before they go through the process of purchasing them. Sometimes insurance will cover them.
The compression that LeBron is wearing, if somebody were to use those after having had a DVT, is that dangerous for them?
Well, the compression is not the same. As you see in that little schematic at the bottom, it's a press and hold, which is different than some of those press and hold in terms of timing and how it inflates. The reason, again, sidebar, the reason you see a lot of these sports figures, you see all your marathoners now, 10 years ago, they didn't have it. And now you see them at the finish line. Is the theory is that if you demand a lot of blood to your leg, meaning our arteries, to your muscles, you have to get that vein flow back. And so the theory is that you're improving venous return as a competitive athlete. If you think of like somebody like Kevin Durant that's 7 foot tall and wears the full length ones, his venous pressure is going to be very high because he's 7 feet tall. So the theory is he's augmenting his venous return so he doesn't get leg heaviness, swelling, and things that as a professional athlete, he can't have. Now, are there studies that really well show that that's what is happening physiologically? Not so much, but you'll see a lot of athletes think, their performance is enhanced by wearing compression. I mean, you see like Russell Westbrook, he wears one on his arm, and I was like, okay. All right. So just one more thing. I mean, I think this issue about compression, we have a number of studies that are going on. I want to give a plug for the C-Track trial. I'm on the steering committee. This is looking at patients who have blood clots in their high leg and the iliac region. And it's randomizing them to getting that. We now have techniques to open up veins that have been scarred down versus doing things like compression. And we don't know if we should be opening these veins. So this is a $10 million NIH-sponsored trial to resolve it because, once we do a procedure and put a stent in, it's in forever. So Dr. Van Dantham from WashU has spent his life working on these studies. That's the website if you're interested to find out more about it. And there's at least 30 sites around the country. There should be one near you that is doing the study. So I think that's enough with that. And I'd be happy to field any questions that you all may have.
I think what we're going to do is, I know Todd had a few comments and a question, and then we're going to move right away because we have so many questions that have come in. We want to try to get to as many as possible. I'm going to ask you before we move forward, because we have so many people and so many questions, would you be willing to come on again and just do a rapid fire, answer the question for people so we can get them back on and answer everyone's question?
Yeah, I anticipated that. And that's why I was a little concerned about doing a presentation, is that I wouldn't get to the questions. But yes, I'd be happy to do another session.
We'll get you back on so that we can get everybody's questions answered at some point. Todd, back to you.
Well, that was an amazing presentation. And I was, even though this is recorded, and it is recorded, everybody, so you can watch this later. I mean, I've got a whole tab full of notes here. But so we were talking about, you're talking a lot about compression being helpful for PTS, for preventing PTS. That's a big goal, right? What about if someone doesn't have PTS, they don't have any pain and swelling? Would they wear compression to help prevent an actual blood clot? Is that helpful, or should they not wear compression? That's where I think a lot of people are confused. What are your thoughts on that?
So if you've never had a history of a blood clot, and there's certain circumstances where it's actually been studied, I personally think it won't hurt if you're on a 4-hour drive, and you're sitting. But the studies have shown if you don't have a risk factor for blood clot or never had one, even wearing compression on a 4-hour flight, it may be a good thing to do, but there's actually not good studies that show that it prevents blood clots. Okay. Where it does prevent a blood clot is in someone who's had one or someone who has a risk factor for one. So again, women who are pregnant often are prescribed compression, not only to treat the swelling they get, but also to prevent the blood clots. But Todd, it's interesting. There's not a lot of data to know about this. Even in people who have varicose veins, and I do a lot in that world too, you would think we would know that, but we don't have definitive data. In my opinion, it doesn't hurt, but there's this first class syndrome. There were a lot of travel questions on the chat. Yeah. The current guideline is if you are traveling more than 4 hours, again, and you have a history, you should wear some compression. But remember, that's only part of it. You also want to use your calf pump. And a lot of these airline magazines in the back overseas flights will have exercises you can do in your chair if you're stuck in the window seat and can't get up. You have to move the pump. So it's stockings and pump. But to answer your question, there's not a lot of studies that support it. It makes intuitive sense, but we don't have great data.
Exactly. And, patients are just told different things. And so I like to bring up, my quick share is I've had 4 DVTs in the calf. I've had 1 in the groin that I still have, but my hematologist, the pulmonologist, they're not vascular specialists, focusing on the compression part, but they kept telling me, no, you don't need to wear compression. You don't have any pain and swelling. You don't have PTS. You don't look like you have any vein damage. You get plenty of activity. You're always moving. Therefore, they didn't recommend that I wear compression. So that was a confusing factor for me as well, 4 or 5 years ago. So I just think it's important for people to have this discussion with their medical provider for sure. But yeah, like you brought up, when you're traveling long distances on the plane and a car, you still need to take your breaks. You still need to do your foot pumps, your exercises. But it's good to know that if people want to wear compression, that's okay too. I think it's real important for people to know that. So thank you.
Okay, so with that, I think we're going to jump into questions, and Todd and I will just do some tag teaming here. Some of these questions. So I will go first. When should one use compression after a DVT? In the hospital or 1, 2, 3 weeks later?
Excellent question. So it depends. So if you have a lot of swelling and your leg is really blown up, typically we don't, if your skin is very, very tight, we don't apply compression socks. I may even not put in a compression wrap for a few days because you can get tissue trauma and a little bit of bleeding. So we'll let some of that swelling come out. We'll wrap to get it gently. The person can adjust it to their comfort. And then once that swelling is down over the first week or 2, that's when you can go get a compression sock if you need it.
Okay, great. How about I'll take 2 and then you take 2?
Sure.
So how do I know a compression product is doing anything for me?
And that is an excellent question. If you have swelling and it reduces, you get the swelling out and reduces it during the day, then that's pretty easy to decide it does something for you. But if you don't have any of that, then it's really a trial and error. So if you feel achy and, pain and tingly and you wear compression and it's better, then it's helping. And what I tell people is use it for a few days for the symptom you think it's going to help. And then don't use it for a few days and see the difference. And then you'll know. Okay.
And a lot of these questions kind of overlap, but that just shows you that a lot of people are thinking about the same things and they have the same questions. And we've touched on a few things before, but it doesn't hurt to retouch on them. One of the questions that keeps coming in is, how long is it safe to wear compression without taking a break without that compression? Right. I know we talked a little bit about it before, but can you touch on that real quick once again?
Yeah, this is, unfortunately, we don't have any, I can't give you scientific data on this, but there's no data to suggest wearing compression 24/7 does any harm.
Okay. And if anybody maybe tuned into the presentation a little bit late when you were talking about this, maybe you could touch on this, because people don't understand why they hurt so bad. So how does compression help with pains and aches from PTS?
So post-thrombotic syndrome, as we said in the early slides, are due to two problems with the veins. One, there's narrowing from the clot, what I call scarring. So the highway is narrowed and things back up, or the valves that keep the blood moving to the heart are leaking. So the blood falls down, the blood stays in, the fluid gets out and causes inflammation and scar. What compression does is it basically pushes back. It keeps the blood moving towards the heart so it doesn't sit in the leg and in the ankle in particular, so you don't get the inflammation and the skin changes. And you don't have that fullness, which you may not see swelling, but you feel the ache and the pain internally. And compression can reduce the symptoms from that, which would be pain, tingling, those kinds of things.
Great explanation. Thank you. Leslie?
Okay. Oh, wow. I have had both knee replacements done. Can I still wear compression safely?
So this is a completely different topic. So we know after knee replacement in selected patients, they can get a blood clot. So away from the blood clot, it's been shown that 70 to 80% of patients who have knee replacements get lymphedema. And if you think about it, you rip out an old knee, you put in a new knee, there's no way that those lymphatics cannot be disrupted. So wearing compression after a knee replacement reduces swelling that may be due to lymphedema, separate from the whole blood clot issue.
Interesting. That could be a whole different conversation for us to have down the road. Okay. If I'm wearing compression socks, do I leave them on or do I have to remove them if I'm going to be elevating my legs?
Again, patient preference. If you at night take them off, watching TV or the news, you have your legs up, you know, remember, by the end of the day, the compression is not a treatment. It's a Band-Aid, and everybody is going to have some swelling. It's going to help during the day, but by the end of the day, you may be done. You can take them off, get your legs up, you're good.
Okay.
And, you know, we talk a lot about massages. People are always talking about massages. And I know, you know, we have to have approval and everybody's got their own situation, and some clots are active and some aren't. What if someone has had a DVT, they have PTS, the clot has been absorbed, but they find that massaging it helps with the pain? Do you recommend that people get their
this
tabs?
is a really common question. So there's two issues with blood clots and massage, like the typical massage you go to, you know, massage therapist. One is how much blood thinner you're on. So if you're on full dose blood thinner in those first few months before you may go to prevention dose, that deep Swedish massage, you may bruise a little bit. So I tell people who want a massage, like, and not their leg, you know, just know, take it slow, because you don't want that deep tissue that could cause bruising. So it's one's about the blood thinner dose. Okay.
Right.
Now, this whole issue about resorb is, remember, within about 4 weeks, you know, when you cut yourself and you get a little clot, that jello clot is gone within about 4 weeks and is replaced by scar. So you cut yourself and you get a scab. That's what's inside the vein. It's not going anywhere. It is not going to break off by about 4 or 5 weeks. Okay.
Right.
So a massage, again, light massage, because you're probably on blood thinner and don't want to bruise, is fine. Now, massage that you do at a lymphedema therapist is a specific kind that moves fluid away from congested lymphatics. It's a completely different technique. But for me, in someone who's been on blood thinner for a while, it's more about not bruising if they're on, depending on the blood thinner. You know, a lot of the elderly folks, they have fragile skin, they may be on aspirin. You do a Swedish massage on them and they're going to be black and blue.
Right. That's right. So going back to, if someone orders a pair, say on Amazon or from Pro Compression, and they're not exactly sure what gauge, what strength to get, how are they going to know? How can they tell that what they've just bought and put on is too tight? It's too tight? What signals are they seeing? Anything, feeling anything?
So I think think what you said is, and you've done this great, is if they don't feel good, don't wear them.
Don't wear them.
So if you have swelling and you order some off Amazon and you put them on and they feel awful and they're tight and they're cutting, then one of two things is wrong. One, we got to get the swelling out with some wrapping and then see if they help to keep the swelling out. They're maintenance, not treatment. Or if you don't have swelling and you wear them and they hurt, then don't use that pair. And it's like your clothes. You like certain clothes and how they fit. And there's such a variety now in quality and quantity that it's going to be a trial and error to use what feels good, that takes away the symptom that you're wearing them for. But if they hurt, they're not the right ones.
I'm glad you brought up the wrapping to get the swelling down. You know, do that first. I think that people forget about that. But yeah, that's great information. Thank you. Leslie, do you have some more good questions?
So I currently have a blood clot at the back of my knee. It is painful to wear compression socks. They bunch up. Are there other options for me?
Yeah, so we talked in the group, you may be someone who just wants to wrap their leg anyone. You may want to use a Velcro. They're also now in some of the more name brand short and long. So I'm not very tall. If I wore the same one as Todd, who you look tall, then we wouldn't be the same length. And so you may choose to wear one that's what's called a short, or that crew one that I just, showed you. But again, or you may, want a full legging where it's not bunching for comfort. So again, there's no right or wrong answer. You should wear the one you'll wear that treats the symptom that you're wearing them for.
Okay. I'm an APS patient. Can I use compression socks?
Yeah, so APS is antiphospholipid syndrome. It's a group of proteins that confer higher risk of blood clots. And so one has nothing to do with the other as long as you're on the blood thinner that your doctor has prescribed.
Okay, great. Back to you, my friend.
Someone's asking, are varicose veins a sign of blood clots to come?
Not necessarily. So varicose veins can develop in response to a blood clot after veins scar down, and it's another pathway to get the blood back. Or varicose veins, many of us have them after having children or genetically. Having varicose veins does confer a risk of surface vein clots in the varicose veins themselves. And compression, especially with travel and varicose veins, can help prevent that. But they are a risk factor, but it's not everybody with a varicose vein is going to get a blood clot.
Yeah, and people have told to wear compression socks to help with the pain and swelling, but we've had several people say that they feel like they're just not working. It doesn't help with the pain. It doesn't help with the swelling. What do they do now? What's their next step if they're not finding any relief?
Yeah, and I would go through, different compressions, wrapping. And like I said, if you use compression wrapping and it helps you, and then you don't use it and it feels worse, then you know that that's helping. But if it's not, one, don't use it. Or there's other things it can be. Knee arthritis, referred pain from back disease, sciatica. So I get a lot of people that really their pain has nothing to do, and there's all these mimickers. And the way to know is, and compression helps sciatica too in some cases, the way to know is wear them. If they help you, great. If they don't, there may be other reasons you're having pain in your leg.
Yeah, and you were talking about arm sleeves, like Russell Westbrook, like you said, he always wears his sleeve. I see a lot of, I'm a canoe instructor. I see a lot of other instructors wearing sleeves, baseball players, drummers, and rock bands. But arm clots do happen. They're just not as prevalent as DVTs in the legs because it's not the deep vein. But wouldn't those sleeve compression, wouldn't that help?
Yeah, I mean, the arm clots are of two varieties. One is something called Paget-Schroeder, where there's an anatomic compression of the vein underneath the clavicle due to some anatomic reasons. You see that in athletes who get big muscles. The other is in your patients who get central lines, like your cancer patients. Those are the two big groups. Your cancer patients, especially breast cancer, may also get lymphedema, and that's where primarily you'll see the arm sleeves in a patient. The ones that are wearing them, baseball and this and that, again, it's the sports recovery. I don't know the sports literature to know if it increases performance. I suspect not, but it makes them shoot better. I guess it's okay.
Yeah, a lot of times that's a mental thing. Yeah.
All right, so we're officially embarking on summertime tomorrow. We have a lot of questions about tips for summer compression. So what can you offer us for some tips for summer compression?
Yeah, and I showed some of these in my slides, but for women, I have a lot of professional women, teachers, you know, people who wear professional clothes. There are sheer compression open toe that you can wear with a capri or something, open toe, so you can wear a slide and it, you know, you can still have a nice pedicure, and they're a little bit lighter. For gym socks, there is a crew that, you know, again, is going to be okay. You know, you may have to come in and then wrap your leg if you have some swelling. Ankle probably doesn't do that much. You can use a sports sleeve. I have a lot of men that golf. They only need it on one leg, so they'll wear a sports sleeve, kind of look cool out on the golf course. So those are some of the options. And then the other is, you know, you're going to the beach, you're going to the pool, don't wear them. Go have fun, come back in, get your leg up. It's okay.
Okay. I'm pregnant. My legs are swelling. If I wear compression, will that prevent a DVT?
So again, we don't have randomized studies in pregnant women for reasons. In general, I see a lot of women who are developing varicose veins, you know, during that last trimester, and wearing compression helps their pain and swelling. We don't, again, intuitively, you think it would help prevent blood clots, but I can't tell you there's a study that shows that.
Okay. I'm going to throw in one more, and then Todd, I'm going to kick it back to you. My clot extended from lower leg into my abdomen. My groin area has varicose veins. Should I wear compression tights?
So yeah, this is a unique situation. Actually, that's being addressed in the C-track trial that's looking at clotting up higher in the leg. If you, in those patients in particular, you have thigh swelling, and a full sock or a thigh high does tend to be more helpful. Again, if it helps you, then, and it feels better, then I would wear it. But if it doesn't, then I wouldn't.
Okay.
See, a lot of these studies were not, you're seeing a theme here. And that's why I started with all the studies were done to prevent post-thrombotic. And people who have it, which are what you're asking me, people who already have it, we don't have any studies that show, you know, what I've shown you is pretty much what's known. And that's why you're seeing me waffling a little bit, because I don't have the data to say this is better than this. It's more, this is what helps, but in a way, you figure it out what's good for you.
Right. Can you just, we've had some people ask about the C-track trial again. Can you comment on that again, what that is and how they can participate?
C-track, and this is so important. So it's so interesting now, and people who've had a blood clot anytime in the past, more than 3 months old, who have it high in the leg, what's called the iliac veins. We now have ways to open up those scarred down veins and restored flow. But what we don't know if it's the right thing to do to help with people who have post-thrombotic syndrome, meaning pain, swelling, all the things we were talking about. So the C-track trial is a randomized trial. People who have that iliac high vein chronic scar to get randomized to opening up the vein in a specialized center with lots of experience. They have to prove credentials to be in this study, versus the things we've been talking about, compression, exercises, some other things that I do for my patients, to see which one is better at 6 months in helping the signs and symptoms of post-thrombotic syndrome. And it's really important because the body's really clever, and it can find ways to get that blood back, even if the vein is closed. And that's why we're doing the study, because before we do these interventional studies and put stents in people to keep veins open, we should know that it works. And so if you're in that group, I highly encourage you, Leslie, you will have that trial on your site to see if there's a center, or even contact Dr. Vandantham at WashU to see if you're eligible. It's really, really important, because we don't know the answer, and we need to find out.
Great. So for people who want information, come to info@stoptheclot.org, send us an email. We'll provide you the information on the trial itself. you know, hopefully you can get signed up for that. So we're mindful of your time. You've already committed to coming back, so we're gonna hook you in for that one for sure, and that way we can hopefully get everybody's questions answered. I know Todd's gonna take us over to some more poll questions, but before we do that, first of all, I wanted to say this was amazing. I mean, every time I talk to you, I feel like I learned so much, and you're a great resource because it's so confusing for all of us because we get such conflicting information. So A, thank you for that very, very much. And B, we also want to thank our sponsor this evening, which is Cardinal Health. And they've been a great partner to NBCA. So thank you to Cardinal for your assistance in allowing us to have these educational events. And with that, Todd, I'm going to turn it over to you to do the second poll and close things out.
Yeah, and I just want to thank all the patients. The NBCA truly is the patient's house. I mean, we really care about patients because we are patients, and we've been through this before, and we oftentimes have the same exact questions as the newly diagnosed do. There's just so much to learn, but yeah, thank you so much for being here. Like I said, I took a whole list of notes, so I look forward to visiting with you again. Our second poll, so this is our closeout poll. Folks, if you could please just answer these real quick. Question number one, has your understanding of compression therapy for blood clot prevention improved after attending the webinar? Yes, somewhat, or no? And did the information provided in today's webinar change the way you will approach compression in the future? Yes or no? If you could answer those for us, we're going to read the results. I want to remind everybody we've got a new survey out. It's very important that everybody take this survey. Our last survey on the emotional impact of blood clots was huge, and would definitely love to see everybody take this new survey, which I think Julia is going to put up in our chat box, our chat window. Everybody take this survey so we can really get some good data together and share this with medical professionals all over the place. And we have our results. So our first question was, has your understanding of compression therapy for blood clot prevention improved after attending this webinar? Yes, 88%. That's really good to hear. We're really happy about that. Somewhat 12%, 0% on the no. So that's a big plus. And did the information provided in today's webinar change the way you will approach compression in the future? 88% said yes, 12% no. Positive numbers. Love that. Thanks, everybody, for answering those questions, too. This has been amazing.
This has been amazing. Thank you again. Thanks for everyone for coming.
Bye-bye.
Bye-bye.